Hello everyone. So today we are going to discuss case number 701 of surgery. A 51-year-old woman undergoes laparoscopic cholecystectomy for suspected chronic cholecystitis. Intraoperatively, a suspicious mass is found involving the entire thickness of gallbladder wall, but there is no evidence of overlying serosal or liver invasion. What should be the next best surgical step in management? Alpha, chronic simple cholecystectomy; beta, extended cholecystectomy; Charlie, palliative radiotherapy; or delta, radiofrequency ablation. I am going to give you 5 seconds so you can answer this question by yourself. Yes, you got it right. The answer is beta, extended cholecystectomy. Let's discuss why this is the answer. Our answer is beta, extended cholecystectomy. Why this is the answer? Because as we all know, this patient has a gallbladder cancer that involved the muscularis layer but not the serosa. Muscularis layer is involved, which should be proven after the histopathological examination or the other evidences, but I have written it here for a purpose. So, gallbladder cancer, only the serosa is the exception which is not involved. All the other layers are involved. So, we have to do extended cholecystectomy, not the simple cholecystectomy. In extended cholecystectomy, what we do cholecystectomy plus we have to cut the liver segments, which segment 4B and 5 plus lymphadenectomy. Okay, is needed if all the layers are involved except serosa. Okay, remember this statement. So let's discuss why not the other options are correct. Charlie option was palliative radiotherapy, which is reserved for unresectable or advanced cases. Alpha option was continuous simple cholecystectomy, which is inadequate because the tumor has invaded the full thickness. Okay. When the simple cholecystectomy is used, I am going to share a table at the end of this video so you can watch this later. And the delta option was radiofrequency ablation, which is used for liver tumors, not for the gallbladder cancers. Okay. So now I am going to share with you the layers of the gallbladder because the classification of gallbladder cancer mainly depend upon which layer is involved and how much it has extended and where it has extended. So you have to know this. And let's start. The innermost layer of the gallbladder is called as epithelium. After that, we have this layer. This is called as lamina propria. Remember, guys, if epithelium and lamina propria are involved, so we do simple cholecystectomy will be our answer. Beyond the lamina propria, if the muscularis is involved, or the perimuscular fibrous layer is involved, which is outside the lamina propria, these two layers, we have to do extended cholecystectomy. Okay, and if more aggressive cancer that involve the outermost layer, this is the serosa, then we have to change the treatment regimen. Okay, I am going to share a table with you so there you can look it out. So our case was only the serosa was exception. So muscularis or perimuscular fibrous layer are involved and we have to do what? Extended cholecystectomy. Okay. So this is the table that I have made for you. This is very simple and easy. And in the books, it is very complicated. I have make it simpler for you so you can take a screenshot and you can revise it for your exams. Our case was exception of the serosa. So it could be this, it could be this, okay, because it involved all the layers, okay. Oh, and if we have, first of all, if the cancer is in situ or it only involve the mucosa or it involve the lamina propria, we do simple cholecystectomy. From muscularis up to the perimuscular layer, we do extended cholecystectomy, which involve liver wedge and the lymph node. And after that, if we have suspicion of portal vein involvement or the hepatic artery involvement, then we do extended right hepatectomy. Okay, all right hepatic lobe will be resected in this case. Okay, and in the last, if the distant metastasis happen, we have to do palliative chemotherapy care. So you can read it out because the video length will be increased. So I am going to give you this information for just bird eye view. So I hope this video help you in your exams. Thank you so much for your attention. Please subscribe to our channel Sword of Knowledge for more content like that.